Hey, all you respiratory therapists out there who are preparing for the NBRC examination. I'm Dennis Stanley from Respiratory Sensei, and you may know me from LindseyJones, but I want to just help you by preparing you for one aspect of the TMC and the clinical simulation exam. You may not know this, but that exam is split up in 3 different categories of questions. There's recall, there's application, and then there's the analysis questions. And by the way, when you miss a question on the exam, it's probably from the analysis category. So I want to just give you a tip on how to deal with analysis questions. First thing I want to tell you is that every analysis question does only one of 2 things. It either is asking you to interpret the results or put a label on the situation that you see, or it's asking you what you want to do or how you would treat the situation that you see. And so here's an example. For instance, if I told you the white blood cell count was 32,000, I could ask you, how would you interpret that? And you would say, that's a bacterial infection. But I also could skip that question and just say, what would you do about it? And the answer would be, give the patient antibiotics. So here's the trick, and here's the thing I want you to know. That if you get on the examination or you're practicing some questions, for instance, and you are able to interpret the results that you see, you should also always ask yourself, yeah, but what would I do about it? Even if that's not what the question is asking. What you're doing is making sure you always know the 2 things. How do I interpret the results, and what would I do about it? You might find that sometimes you're a little bit fuzzy on what you should do about it or how you should treat the patient. And that's a great opportunity for you to hesitate on those practice questions before you go to the real exam, and make sure you study, ask somebody, and look it up. Find out, yeah, I know how to interpret the results, but what would I do about it? What I find by far and wide is that a lot of people know how to interpret results, but when I ask them, yeah, well, how would you treat that if that's what you found in a patient, they don't necessarily know. And then that might cause them to miss an analysis question on the examination. So make sure, be honest with yourself, make sure you always know those 2 things about every analysis question that you see. How to interpret the results, what does it mean, and then of course, what would I do to treat the patient? All right, that's just my tip for the day.